let's talk about some of the common ailments in pregnancy. So as we all know, there are some very common problems which can happen. These include a lot of weakness and fatigability. There can be morning sickness. There can be even nausea which may not actually translate into vomiting. There is breast heaviness. There may be a lower abdominal pain and you may want to pass urine again and again. Apart from this, there are other problems. For instance, there can be a lot of gastritis. There can also be some constipation. Occasionally, some of the girls also experience loose motions. Problems such as hair loss, or there could be problems like skin issues are also known to happen. Very commonly, we see a lot of backache. Sometimes leg cramps can happen. Sometimes there are also conditions like piles which do become exacerbated. So these are some of the common problems which happen in pregnancy. Let's talk about some of the important ones and how we can deal with them. So it's not going to be a very long video because I know that one will not be able to focus so much on very long videos. So let's just think about a few common things and how to deal with them. So for instance, whenever there is easy fatigability, the only way to kind of get around that is by doing some form of exercising. Make sure that you're walking at least for 30 to 45 minutes every day, between 5 to 6 times a week. Whatever form of exercise, be it running, be it jogging, it could be swimming. These are some of the very common forms of exercise which must be carried on. Apart from that, when you think of easy fatigability, eat well, eat right. It's not difficult to, it is actually difficult to eat for 2 people. So it is important that you have small portions, small frequent meals. Have lots of green vegetables, make sure you have seasonal fruits, keep yourself well hydrated. Also make sure that you're sleeping for at least 8 hours in the night and if possible for at least an hour in the afternoon as well. So all these factors will kind of take care of the easy fatigability. Then apart from that, let's talk about morning sickness. First of all, the name itself, it may not happen in the morning. And most times, this is a problem which will happen in the initial 12 to 14 weeks of pregnancy. So some people can have it even throughout pregnancy. There may actually be vomiting or there could just be nausea. Make sure that first of all, you do not eat those food items which cause this nausea. Sometimes smells can also evoke nausea and vomiting. So avoid those food items completely. Get up in the morning, have a dry cracker or a biscuit or dry bread. Apart from that, make sure that you have a little ginger with you, that can also be used. A little bit of lemon also helps to take care of this nausea. And of course, there are medications which are available to take care of this nausea and vomiting in pregnancy. Then apart from that, when we consider backache is extremely common. And why does that happen? There are hormonal changes which happen in pregnancy. There is some, sort of weakening or some of the flexibility of the ligaments which happens because this is nature's way of preparing for labor and delivery. And along with that, there is some amount of pressure of the growing uterus and the fetus. And that's the reason why there will be a little change in the posture as well. So these are some of the reasons why backache can happen. Sometimes backache can also happen because of constipation. So to basically take care of this backache, make sure that you have a good posture. Apart from that, sit comfortably. Apart from that, you can also use a little bit of the gels which are available. The painkiller gels can also be used and hot fermentation can also be done. And make sure that you're having your calcium supplements and vitamin D supplements as well. Then we also consider some of the common things like constipation. Again, lots of green vegetables. Make sure that you're having a high fiber diet and let's try and limit the medicines that we take. But if required, you also have medicines available like laxatives which are easily, which can be taken in pregnancy. So these are some of the common problems. We also have problems like, the hair loss that can happen. So again, good vitamins and enough of, exercise, eating right, all these things will help. Then of course we do have the skin problems, which are part and parcel of the hormonal changes which happen in pregnancy. So most times, we just have to kind of bear with it. For stretch marks, we do have some creams which are available, but a lot of times, let me be very honest, most people will not recover from those stretch marks, and there will also be some increased pigmentation in the form of a pregnancy mask which is called chloasma, and there can also be a central line in the abdomen which is called the linea nigra. Also, you will notice that the nipples do get a little darker. There are some changes which happen in the nipples as well. So, these are little problems which can definitely get sorted out. Do not get distressed because of these problems. If there is any issue, just feel free and discuss it with your doctor, because a positive outlook is definitely very important where it comes to the journey of motherhood. It's a long 9 months, but make sure that you take it positive.